going to discuss about a very important topic of head and neck region, that is the cervical plexus. So in this diagram, it's showing you the cervical plexus and its branches, the superficial branches, the deep branches, the communicating branches. So we must have to understand what is the cervical plexus. So first thing, please remember, cervical plexus, it is formed by the ventral rami of upper four cervical nerves. Okay, so it will be formed by the C1 fibers, C2 fibers, C3 fibers, and C4 fibers. So these upper four, you can say the ventral rami of the upper four cervical nerves, they are going to form the cervical plexus. Now, very important point in relation to the cervical plexus, that this cervical plexus anteriorly, or it is anteriorly present to the prevertebral fascia, the internal jugular vein, and sternocleidomastoid muscle. Okay, so anterior to the cervical plexus and anteriorly to the prevertebral fascia, the internal jugular vein, and sternocleidomastoid, the plexus is related, and the plexus is related posteriorly to the muscles which arise from the posterior tubercle of the transverse processes. Okay, that is your levator scapula muscle and the scalene medius muscle. Okay, so these relations are very important in relation to cervical plexus. So please remember, the plexus is related posteriorly to the levator scapulae and scalene medius muscle, and anteriorly it is related to the prevertebral fascia, the internal jugular vein, and the scalene medius muscle. Now you must have to see this diagram and try to understand it. Then we are going to make this diagram ourselves also. Okay, so first of all, you must have to know that this C1 fibers, this is the C1 fibers which I am highlighting in the blue color. So this C1 fibers, it is making here the superior root of ansa cervicalis. So this is the superior root of ansa cervicalis. Ansa cervicalis means loop. Okay, and C2 and C3. Now see here, this is the C3 and this is the C2. So C2 and C3, they are joining together and forming the inferior loop of the ansa cervicalis. So this is the So this is the inferior root or inferior loop of the ansa cervicalis, like this. So ansa cervicalis superior root is formed by the C1 nerve fibers, and C2, C3 are joining together, forming the inferior loop of the ansa cervicalis. Now ansa cervicalis is giving here three branches. Number one, it is giving nerve to the sternothyroid muscle. Number one. Okay. Second, it is the sternohyoid muscle. And third one, it is giving innervation to the omohyoid muscle. Omohyoid inferior belly, omohyoid superior belly, both are innervated by the ansa cervicalis. Okay, this is the first important thing, that is the ansa cervicalis which you must. Now C1 fibers are also, please remember, the C1 fibers are joining with this hypoglossal nerve. Hypoglossal nerve is your 12th cranial nerve, which is innervating the muscles of the tongue. Okay, so the muscles of the tongue are innervated by what? It is innervated by your 12th cranial nerve, that is the hypoglossal nerve. One thing please remember, that all the muscles of the tongue are innervated by the 12th cranial nerve, except one muscle, that is the palatoglossus muscle. So palatoglossus muscle, it is not innervated by the 12th cranial nerve, it is innervated by vago-accessory complex, or in simple thing you can write it as the 10th cranial nerve, the vagus nerve. Okay, now please remember very important point. This C1 fibers, it joins the hypoglossal nerve, and now it will carry the fibers to the two muscles. What are the two muscles? Number one is the geniohyoid muscle, and second one, it is the thyrohyoid muscle. It is what? Thyrohyoid muscle. Now what are the important superficial or cutaneous branches which is coming out from the uh, cervical plexus? Number one, this is your this nerve. This is your lesser occipital nerve. Then this one, this is your great auricular nerve. Okay, then this branch which is coming out transversely, it is known as transverse cervical nerve. And then this branch which is going downward here, that is your supraclavicular nerve. So 4 branches you must have to remember. So the 4 superficial branches of the cervical plexus which you must have to remember, that is the lesser occipital nerve. Number 2, great auricular nerve. Number 3, transverse cutaneous nerve of neck region, or transverse cutaneous cervical nerve, same thing. And fourth one, it is your supraclavicular nerve. Okay, so these 4 superficial branches are very important. Along with this, see here, some fibers are also in relation to our 11th cranial nerve, that is the accessory nerve. So please remember, a branch from especially C2, is going to the sternocleidomastoid muscle, and branch from C3 and C4, it is also giving innervation to the trapezius muscle. So it is communicating with the accessory nerve, which is your 11th cranial nerve. Please remember, 11th cranial nerve, that is the accessory nerve, it is innervating two muscles, the sternocleidomastoid muscle and the trapezius muscle. So branch each from C2 to the sternocleidomastoid and from C3, C4 to the trapezius. It is communicating with this 11th cranial nerve also. Okay. Now see this diagram of students. So 4 branches. So this is our sternocleidomastoid muscle, and this is the midpoint of the sternocleidomastoid muscle, and from here 4 branches of the cervical plexus are coming out. First branch, this is your great auricular nerve, which is supplying to the auricle. As you can see in this diagram, greater part of the auricle to the angle of the mandible. Okay, angle of the mandible, and to the parotid gland also. Skin of the parotid gland. Transverse cervical nerve, this one. It is innervating your skin of the neck region. Lesser occipital nerve, it is going behind and innervating back part, scalp region. And then this part, this is the supraclavicular nerve, which is innervating the upper portion of this supraclavicular region. Okay, so these 4 branches, they are coming out at the midpoint of the sternocleidomastoid muscle. See here, transverse cutaneous nerve of the neck region, this is the region. Great auricular nerve, angle of the mandible, parotid gland, skin, and greater part of the auricle. Lesser occipital nerve to the scalp region and behind the ear, and this whole region, it is innervated by your what? By your supraclavicular nerves. Now we must have to draw this cervical plexus diagram ourselves. So very easy diagram. So we can draw it like this. See here, all students. So first of all, you have to draw something like this. So this is your C1, C2, C3 and C4 fibers. I can add here C5 also, but please remember C5 is not a component of your what? Cervical plexus. But I will explain you why I draw here the C5. But ventral rami of C1, C2, C3 and C4, it is forming the cervical plexus. Now see here how you can understand these root values of all these nerves. Now see here, along with the C nerve, one nerve fiber here, if it is going like this, here your which nerve is coming out? Your 12th cranial nerve is coming out, that is your hypoglossal nerve. This is your which nerve? Hypoglossal nerve. So it is taking out the fibers of the C1 fibers, okay, like this, and now it is innervating all muscles of the tongue except platoglossus, which is innervated by your which 10th cranial nerve or vagoaccessory complex, same thing. Okay, now see here, C1 fiber, it is going here and innervating the two muscles. What is the name of these two muscles? Why your fibers of the 12th cranial nerve? So this is your geniohyoid muscle and this is your thyrohyoid muscle. Okay, now this C1 is giving here the superior root of the ansa cervicalis. So this is your what? Superior root of ansa cervicalis. Superior root of ansa cervicalis. Okay, now see here next thing. From C2 and C3, fibers are coming here like this, and now they are joining together and forming this loop. So this is the what? Inferior root of ansa cervicalis. Okay, inferior root. It is formed by what? C2 and C3 fibers, and now it is innervating here three muscles: omohyoid number 1, number 2 sternohyoid, and number 3 sternothyroid. Omohyoid both bellies, but I write it here like this so it will be easy for you to remember. Now the nerve root values of the nerves. See here, all students. C2, it will give here lesser occipital nerve. So lesser occipital nerve root value will be C2. Done. C2 and C3, two nerves. That is the transverse cervical nerve and your greater auricular nerve. Greater auricular nerve. So greater auricular nerve and transverse cervical nerve, their root value is C2 and C3. Now see here. C3 and C4, it is giving you the supraclavicular nerve. Supraclavicular nerve. So the supraclavicular nerve root value will be what? C3 and C4. Done. Now you can ask me, sir, why you draw here the C5? So see here, C5 why I draw here? Because one very important nerve is coming out here. C3, C4 and C5, both all three are joining together, forming here one nerve that is known as the phrenic nerve. Okay, but if you ask me what is the root value of phrenic nerve, I will tell you C3, C4, C5, but majorly it is the C4. Okay, so 3, 4 and 5 keeps the diaphragm alive. Okay, keeps the diaphragm alive. So what is, please remember, phrenic nerve, it is a mixed nerve. Okay, so your phrenic nerve is what? It is your mixed nerve. So phrenic nerve, it is a mixed nerve. So it is having both the motor component and the sensory component. Motor component, please remember, it is innervating the diaphragm. 3, 4 and 5 keeps the diaphragm alive, which is the keeps the diaphragm alive, which is the main muscle of your respiration. Keep the diaphragm alive. Sensory, it is to the mediastinum, especially the mediastinal pleura. Pericardium is also innervated by the phrenic nerve, and the peritoneum, upper and lower surface of the central part of the diaphragm. Upper and lower surface of the central part of the diaphragm. Sensory innervation is again, it is your by phrenic nerve. So this is your whole diagram of cervical plexus. Okay, very easy topic, and if you draw this diagram, it will be very easy for you to understand. Okay, and one last thing, please remember, in relation to your C1 nerve fibers, please remember, C1 is never, there is no skin supply of the C1 nerve fiber, so that's why there is no C1 dermatome. Dermatomes will start from your C2. Okay, so this is your topic of cervical plexus. I hope it is clear to all of you. Thank you.